right, so what we're going to do today is I'm going to go over some things on Medicare.gov that is occurring in 2025. So we're 3 days away from January 1, 2025. With this being said, there are a lot of changes that are occurring for Medicare Part D beneficiaries coming in 2025. There's the Medicare Prescription Payment Plan. This payment plan will actually allow you to spread the cost of your drugs out across the calendar year. Therefore, when you go to the pharmacy, you don't have to pay anything because you're just going to pay it directly to the plan itself. The other piece is going to be there is a $2,000 maximum out of pocket for all Medicare beneficiaries as it relates to Part D or prescription drugs next year. This means that no matter how much your drug costs, you will never ever pay more than $2,000 out of your pocket. This year, that number is roughly $3,200. The third piece is there's no more donut hole in 2025. That is huge for Medicare beneficiaries who have in the past had high drug costs and therefore fallen into the donut hole, being subject to pay 25% of the cost of their medications. So what I want to talk about today in particular is the $2,000 maximum out of pocket and how some people, depending on what plan they're in and what drugs they're on, they will reach the $2,000 out of pocket without actually pulling $2,000 out of their pocket. Okay, so we're going to start by going to Medicare.gov, and Medicare.gov is a public website. As a licensed insurance agent, I use this whenever I'm selling products because I want my beneficiaries to be able to go home and duplicate what I've done and actually see the plan options as well. If you are a pharmacist or you're a physician or you're a nurse or someone who works directly with Medicare beneficiaries, or maybe you're a family member that has someone who's on Medicare and you want to know more about it, Medicare.gov is the place to go. So once you get here, you scroll down and we're going to go to find plans now. And the first thing it's going to ask you to do is to put in a zip code. And that's because you have to see what plans are available in your area. So we're going to go to 29201 and we're going to pick something in South Carolina and in Richland County. So we're going to do Medicare Drug Plan Part D only is where we're going to start. Now, the reason you would have a standalone prescription drug plan or this Medicare Part D drug plan is because you have original Medicare, which is A and B, and which pays 80%, and then you have a supplement plan, which is going to pick up that other 20%. In that case, you also have to have a standalone prescription drug plan in order to pay for the prescription side of your benefits. So when we do this, we go to find plans, and this is just asking, do you have Medicaid or extra help? We're going to do no, and we're going to continue. Do we want to see our drug costs? The answer is yes, and then we click next, and then we're going to put in the actual drugs. So we're doing Eliquis, and we're going to do 5 for $60 for us to look at. So we're going to add in atorvastatin. And you can drop down from the menu and pick whatever you get, and then they'll tell you the usual quantity, and you can also pick every month, 3 months, or whatever. But we're just going to go with what comes up because it's just easier that way. Ozempic and Linzess. Okay, so let's just go with these and then let's do done adding drugs. And then what comes up is you have to choose which pharmacy you want. And so it's only going to give you retail and mail order. I usually just going to pick the first one that comes up. And I usually pick a major retailer if not for educational purposes. But if you are meeting with clients because you're an agent, you absolutely pick the drugstore that they actually use. If you are a pharmacy and you want to know what's covered at your store, then of course you would pick your pharmacy if this person's going to your store. Okay, so for this particular one, the way the plan finder works, remember, is it's always going to give us lowest drug and premium cost and for the year. And so because it's December the 28th, it is giving us the plan as if it's effective January 1. So whenever you're actually looking on the plan finder, it's always going to give you when your next effective date would be. So anytime you enroll in the month, your effective date is the first day of the following month. So what comes up first is this United Healthcare plan, and the premium is $89.20. The total drug and premium cost, see, for the entire year of 2025 is $1,532.40. Notice it says estimated total drug and premium cost. So $89.20 is per month is included in this $1,532.40. So what I like to do whenever I'm looking at a prescription drug plan like this, I want to know how much of it is actually premium. And so 89.20 times 12 is $1,070. So the drug itself is about $530. So this is a pretty good plan from a drug expense standpoint because you're not going to be paying as much for the actual drugs. However, the bulk of your money is going into the premium. So the next plan is this Cigna Health Saver that is $21.20 per month, and the total drug cost is $1,974.66. So this tells me that bulk of this is drug and not premium. And then the next one is this $0 plan with the WellCare value script, and the total drug and premium cost is $1999.03. I am going to use this plan because I really want to focus on the $2,000 max out of pocket. I'll do another video where I will tell you which one of these plans I would have actually gone with or recommended for the client. But because I really want to just focus on this $2,000, I'm going to use this WellCare value script plan. So we click plan details and it's going to load up for us. And what we see is it has a drug deductible of $590. That is the maximum drug deductible that CMS, the Centers for Medicare and Medicaid Services, has put into place for 2025. This is important when it comes to this $2,000 out of pocket because this is telling me that WellCare chose to do the maximum or the basic plan that CMS has put into place. So it's got $590 drug deductible. And then when we scroll down, I just want to go straight to the drugs. This is the yearly cost. You're going to pay $500 for Eliquis, $819 for Linzess, $678 for Ozempic, and total drug cost is $1999.03 for the year. When we keep scrolling down, we're going to go and we'll see that this person with this drug list, they'll pay $940 in January, $498 in February, same amount in March. In April, they'll pay $61.33 because they had met their max out of pocket at that point. And then from May to December, they do not have to pay anything in drug costs. Now, what I want you to see is when we scroll down here, these are what the tier structures are. Preferred brand is 25%. Non-preferred drug is 37%, specialty tier is 25%. This is a defined standard benefit plan. Basically what that means is this is the parameters that CMS has set out and said that your preferred brand tier, you can have a 25% co-insurance and your $590 deductible. So in this particular plan here, WellCare or this particular carrier is not providing any enhanced coverage for the Medicare beneficiary. So that's why the Medicare beneficiary is subject to pay the entire $2,000 out of pocket for this particular plan. So when you expand out CVS, which is the drugstore that we chose, you see what the costs are. So the cost before the deductible for the Eliquis is the full price, because remember, if you're on a medication that's subject to the deductible, you pay the full price until the deductible is met. And for this plan, it's $590. So if they fill the Eliquis first, they pay the first $583.70. After that, it goes to 25% of that cost, which is $145.93. And then once they are out of, once they have met the $2,000 out of pocket, it goes to zero. So you may be saying, I got to pay $940.62 come January, and that's what you would pay if these were your drugs and you were on this particular plan. Well, the Medicare prescription payment plan that's also new for 2025 will actually help with this. So let's scroll up so we can see that. Where is it? Right here. So it says the Medicare prescription payment plan is a new payment option that works with your current drug coverage to help you manage your out-of-pocket Medicare Part D drug costs by spreading them across the calendar year, January to December. All plans offer this payment option and participation is voluntary. You can go and click in this button and it will actually show you a video of more about the plan, about the Medicare prescription payment plan. What I like is this one right here. I think CMS did a great job of actually showing you what your costs would look like with the drugs that you put in. So if you use this CVS with the drugs that we put into the plan finder and you opted in to participate into the Medicare prescription payment plan, in January, you would pay $166.67 for your drugs. In February, you filled your prescriptions again, you'll pay $115.68, and then it just keeps going and keep going, and then you have these payments that you will be paying until you reach the $1999.03. So what you can see is they took the amount and they spread it out, the cost from January to December, versus if you paid out of your pocket, you would have to pay all of this out January January through April, and then May through December, you would pay nothing. So whenever you're looking at the Medicare prescription payment plan, you have to ask yourself, number one, can I afford to pay $940.62 in January? If the answer is yes, then the Medicare prescription payment plan may not be beneficial for you. If you are someone who says that's a lot of money and I'm not able to afford that, however, I can afford to pay $166.67 per month, or as high as $172.35 per month, then the Medicare prescription payment plan would be beneficial for you. Maybe you're one of those folks that says, I really would just like to just get this $2,000 out of the way instead of having to make all these payments all year long. So if that is the case, if you can pay your drug costs at the pharmacy for January, February, March, and April, you can see from May to December, you don't have to pay anything out of your pocket when you go to the pharmacy. So these are just some of the ways you need to look at whether or not the Medicare prescription payment plan is actually beneficial for you to opt into. Remember, it is totally voluntary. You do not have to opt into it. It's just there as a way to help you spread your costs out across the year to give beneficiaries more flexibility in actually being able to pay for their prescription drugs versus having to pay it at the pharmacy. If you do decide to opt into this program, whenever you go to the pharmacy, you may not know how much your copay actually is. You will not know until you receive the bill from your health plan that's saying this is how much your drugs were and this is how much your monthly payment is going to be. Okay, so those are just some things that I want to share with you about the Medicare prescription payment plan for 2025. Now, I'm going to end this video here, but I'm going to continue going because it looks like we're about 15 minutes in. So I'm going to end this video here because I know it has been a lot. It's a lot to take in when it comes to Medicare. However, I'm going to go immediately into another video. I want to take these same drugs and I want to show you what it looks like in a Medicare Advantage drug plan. Thank you so much for watching this one.